The return involves nearly half of the probation staff calling out of their shifts at Los Padrinos on Super Bowl Sunday because this work is taking a toll on them too. I was there on Sunday to do a staffing audit. Of the 60 staff that we were given like numbers to based on the unit, 26 were either being held over or had volunteered because they were aware that there were going to be call-outs related to Super Bowl Sunday. So these are 26 people, some who are what are called GSNs or night staff, right? So they don't really interact with these young folks. They've been up all night and they're being asked to put in another 8 hours. Another, again, that was I think 14 or so, and then another 12 had just volunteered. And those were folks who are out in the community, who are field supervisors or field DPOs, who generally don't work inside the halls, but they're showing up because they care, but not because they necessarily have the skills to be inside halls and care for these young people. The return also involves absolutely no accounting for the $88 million the state has given to LA County for our kids who would have gone to DJJ. The return is facilities that cannot even meet the most basic of minimum standards set forth by the BSCC. The return is kids hoarding empty milk cartons so that they have a place to urinate when staff can't or won't open their bedroom or cage doors. The return involves so much trauma. And I was a terrible business major, hated nearly every second of it, but I can speak with confidence when I say this is a terrible return on our investment. A public health approach requires building out alternative stat. A public health approach requires really looking at the experience, the education, the opportunities we're spending our dollars on, and asking OYCR to track that spending, evaluate these programs, and assess the outcomes for our young people, not just by relying on like county reporting, but by talking to all of the stakeholders and reporting on that. Because what happens in a county like LA, because it's a county family, public defenders, for example, aren't allowed to speak in contradiction to what they're seeing being done in the hands of the probation department.
Wow, I can listen for you for a full hour.
Stop. Okay, sorry. I just want to like wrap up really quickly. I just want to say a public health approach really requires incentivizing our county to surround our young people with humanity and care. We need to diversify the power. It cannot solely be in probation's hand to spend this money to think of solutions, to handle the education, to handle the reentry, to handle all the things. We need to diversify the power and we need to diversify those investments because the probation department cannot be the primary institution provided to meet the unmet needs of our Black and brown young people.
Thank you so much. Colleagues, any initial thoughts before we bring up the rest of the panel? Senator Roth.
Thank you, Madam Chair. I'm taken by your remarks, ma'am. I'm trying to, I came out of the military, so what gets measured gets done, and we believe in accountability and people being held accountable. So where does the buck stop here? Doesn't it stop with the Board of Supervisors?
I think the buck stops with both, the probation department and the Board of Supervisors. The Board of Supervisors approves the budget for the probation department.
And the chief probation officer works for?
The Board of Supervisors.
Board of Supervisors. I want to pin the tail on the right donkey.
I agree with you, but also, right, the way the Welfare and Institutions Code lays out who holds the power and who runs these facilities, that's the probation department. So I think they go hand in hand. Yes, the Board of Supervisors approve a great deal.
They're all my friends, so I don't want them to think that I'm spanking them.
I'm appointed by one of them, right? And my ability to go inside the facilities and see what is happening on a regular basis is because of my appointment. But I entirely agree with you that the Board of Supervisors play a very large role in what is happening and what they are allowing to happen and where they decide to make their investments and what they decide to prioritize. But we are all responsible, right?
And I guess just one quick follow-up. I guess you don't disagree that in some cases, some youth, at least on a temporary basis, need to spend time in a carceral setting, but that it's just the type of carceral setting that you're talking about?
Personally, I don't think any young person benefits from being in a carceral setting. You are only compounding their trauma. You're only normalizing what prison looks like. The number of young folks that I've talked to, whether they're in there for a violation for 7 days or whether they're in there fighting their fitness for 3 years, can speak to the trauma that comes with being there just for one night. LA County has this beautiful vision that they've laid out called Youth Justice Reimagined. That's obviously difficult to implement when we have Welfare and Institutions Code that mandates certain things be held by probation. But when we keep young folks in smaller settings when they're cared for by folks who don't have to use OC spray, who don't have to use room confinement, who don't have to lock the door behind you, I think we can expect different outcomes.
Are there examples, either in the United States or somewhere else in the world, where youth who have committed offenses, because that's why they're there, perhaps more serious offenses, are treated in a different way in a home setting where it actually works?
New Zealand. Some of our colleagues actually spent some time in New Zealand looking at their system that I think is much more dedicated on the healing of young folks and recognizing the role that that plays in public safety. Because to be quite honest, what we've created right now does nothing for public safety. We're not making our communities safer, because when these young people leave, which, fortunately most of them do, whether again it's after 7 days or 7 years, we haven't done much to ensure that they're not going to cycle right back into the system.
Very interesting. I really enjoyed the conversation. I don't want to belabor the point, though, but thank you, ma'am.
Oh, and New York also has a smaller kind of like community-based approach.
Thank you.